I am now pleased to introduce our first speaker, Dr. Lauren Brinkley-Rubinstein, Associate Professor and Director of the Re-Envisioning Health and Justice Lab in the Department of Population Health Sciences at Duke University. She is a national expert in examining how the criminal legal system impacts people, families, and communities. We're so honored to have her with us today.
Thank you, Catherine. I appreciate the invitation, and I'm excited to spend the next 15 minutes or so really setting the stage for other presenters. Okay, so what I'm going to do is really talk about incarceration as a determinant of both individual and population health. There are my credentials again. I want to put forth a roadmap to give you a sense of what I'll discuss in the next few minutes. First, I'll talk about the history or context of incarceration in this country and be really explicit by what I mean when I talk about the criminal legal system or incarceration. And then I'll go from there and speak about the intersection of incarceration and health. So this is a chart that many of you may have seen before. There are a couple of important things that I want to point out. If we go all the way back to the beginning of this chart in the 1880s, even then the rate of incarceration in this country was far outpaced that of other countries. So we've always had this elevated rate of incarceration. If we look to the late 70s, the early 80s, big changes in the number of people who are incarcerated in this country, and that's largely due to the war on drugs, changes in sentencing policies, harsher sentences. If we look to the future, if we look to now, this is a kind of dated chart, but the trends remain that incarceration in many ways, the rate here has plateaued, still much, much higher than the rate of incarceration in almost any other country. And I want to be explicit about what I'm talking about when I talk about incarceration. There are state prisons that account for about 1 million people who are incarcerated. These are run by states. There's one in every single state. They tend to hold people who are sentenced and are serving longer sentences, usually about a year or longer. About 600,000 people in any given year are in local jails. Almost every county has one. Important things to remember about jails are that one, they have a very short average length of stay, about 72 hours on average. So people really churn in and out of jails. If we look at any given year, about 11 million people in total go in and out of our jail system. That's a massive number of people that are exposed to jail conditions. Smaller slice of the proportion is federal systems, and we see federal systems in almost every state. Those are people who are convicted of federal crimes, much smaller than state or local jails. Then we have about 4 million people who are on community supervision, so under some type of carceral control, but in the community, and this can be post-release supervision or parole or probation. And it's impossible to have this discussion without focusing in on racial inequities. I'm using the phrase mass incarceration here, but in fact, a lot of people really don't like that phrase because it denotes that incarceration equally impacts all segments of society, and that's not true. People prefer to use the phrase hyper-incarceration because that more explicitly tells us that incarceration impacts certain communities more than others. If we look at this graphic from the Prison Policy Initiative, we can see that Black people, Latinx people, and Native people have greater proportion of people in prisons and jails as compared to the proportion of the general population. It's important to note that this doesn't have anything to do with crime. If we take the example of drug use, lots and lots of studies have shown that, in fact, often white people use more drugs than these other groups. It really is where police are at, where they're deployed, where resources are allocated. And it has to do with the legacies of slavery to Jim Crow to mass incarceration that has set up the current paradigm that creates racial inequities in the system itself. And I'm trained as a community psychologist, so there are people on this call who work with me who are really over the fact that I'm always having some kind of social ecological model on the screen, but here it is again. And I think this is a nice way for us to think about all the different levels of impacts that incarceration or other facets of the criminal legal system can have on people. If we start with individuals, that's easy. It's individual health behaviors. It can be individual health outcomes. I'll talk about those on the next slide. But I think it's important to also talk about the other levels that incarceration can impact. So one is incarceration impacts families, relationships, friends, social networks, measures of social support. It also impacts organizations. This is a little bit more of an abstract concept, but in my lab, we like to talk about this concept of carceral creep. And it really is this creeping of carceral logic into other social institutions in society. A couple of examples might be school systems that in more recent years have leaned into punitive solutions to address social problems. The presence of things like school resource officers. It also, we see it manifesting in healthcare. So the idea of the non-compliant patient or punitiveness when patients don't comply with doctor's orders. There's also an emerging body of literature that takes it beyond the individual, that looks at population health and the impacts or the relationship between community health outcomes and density of incarceration. I'll also talk about that on the next slide. And lastly, I just want to talk a little bit about public policy, because the carceral system or the experience of incarceration can be quite different depending on where you might be incarcerated. And those of us that do this work often say, you've been in one jail, you've been in one jail. It's true that carceral systems do have some similarities across systems, across facilities, but they're all really different. And the impacts of incarceration, the collateral consequences or the restriction of rights that people might experience post-release is really determined by local policy. And so being incarcerated in one county could be very different to the next, and it can certainly be different from one state to the next. And it certainly looks different now, depending, compared to like what it might have looked at like several years ago. So it's also varying across time. I want to spend the rest of my time really talking about disparities in health, or the certain conditions that are overrepresented among people who are incarcerated. And it's important to note that if we take any health outcome, we could probably map it on in the same way, because there are extreme disparities in almost every condition that you can think of when it comes to the incarcerated population. On average, people who are incarcerated have at least 2 chronic conditions, so a big overrepresentation of chronic illness in general in this population. I'll focus in a little bit on some specific outcomes though. So first, thinking about infectious diseases. Many studies have looked at the disproportionate rate of HIV and has shown that it is 2 to 7 times higher. Additionally, about 17% of all people living with HIV in the US pass through some carceral facility in any given year. If we take a look at hepatitis C, we see similar disproportionality. The rate is about 8 to 21 times higher than the general population. And this goes on and on with other sexually transmitted infections. We see similar patterns. Not on this graphic is COVID-19. This is an older graphic. Our group has done a lot of work focusing in on disparities relevant to testing, treatment, diagnosis, and mortality relevant to COVID-19. We found that the rate of COVID-19 tends to be about 5 times higher than the general population, and the age-adjusted death rate is about 3 times higher. This links back to the overrepresentation of chronic illness, so people who are incarcerated tended to suffer more severely from COVID-19. Also, on average, before the pandemic, prisons were overcrowded. And so you have overcrowded facilities, very little ability to engage in things like social distancing, really created a perfect storm for transmission of COVID-19. When it comes to substance use or mental health outcomes, we also see disparities here. So if you see that bar chart here, big differences in the number or the rate or the proportion of people who have substance use disorders who are in carceral facilities compared to the general population. And that is in part because illicit substance use can lead to incarceration. So there's, it's hard to disentangle that. We also see when it comes to serious mental illness in jails, big disproportionate rates. And I think many of us have heard that jails in this country have become the largest healthcare provider for mental health. And that is really because of gaps in access to mental health in the community itself. And we see this play out in prisons as well. There's also an increased risk of mortality post-release, and it runs the gamut of causes. So if we look at all-cause mortality, disproportionate rates, if we look at specific things, there are some things that are important to note. So if we look at that immediate post-release period, there's been a lot of work actually looking at the 2-week post-release period that has shown that overdose is a leading cause of death. And that really links back to this disproportionate rate of substance use disorders among people who are incarcerated. And then I want to focus just finally on community outcomes. So I'm going to highlight 2 studies here because this takes us away from the individual and back to the population health perspective. One recent study examined rates of sexually transmitted infections as a function of jail and prison incarceration rates. They found that the documented differences in chlamydia and gonorrhea incidence between counties was partially attributable to those differences in jail and prison rates. So we see this association between higher rates of incarceration and higher rates of various STIs. Similarly, another study that was published in 2021 found a strong association between jail incarceration and also mortality from infectious diseases, chronic lower respiratory disease, drug use, and suicide. And so all of this is really to set the stage for the presentations that are coming up next and to give a little bit of insight into the impact of incarceration, how it can impact people, various health outcomes, impacts on families, and also whole communities. And that's it for me, and I look forward to answering questions at the end of the presentation. Thank you.
Thank you so much for giving us that overview of the history of incarceration and the impact on health outcomes.